competing with these large pharma companies that have huge amounts of resources and data, or like AI companies that have like a lot of expertise on the AI side? How do you see yourself within the picture alongside those?
I wouldn't say we're competing with them. So I would say they are like potential collaborator or, potential people who could complement them. Try to reach the people in the industry. I feel they're more open to help you out. But usually it's changed a little bit. I think it's very difficult. So a startup company, it's a very, very difficult process. So, but it's also very rewarding.
Maybe we need a new regulatory body for the innovation, because FDA is very focused on safety. How about innovation?
I mean, at the end of it, you need to have a product of innovation, right? So innovation would lead to something, right? There's improved therapeutics or improved diagnostic or improved delivery, right? So it's gonna be the end product of the regulation. I mean, the innovation, would lead to, it needs to be proved basically based on both safety and also efficacy, like if it's helping or not.
Then you're in love with your problem that you actually found a company based on that, which is not traditional. Like, I think you did a bunch of internship on pharma industry, on Merck and others.
Yeah.
And then you see, okay, I can found a company, Revivemed, I think founded in 2018. So that's I think it's really interesting to point it out. So how was your thought on that time?
Yeah, it was a process. It was not like one day I woke up and said, hey, I want to start a company. It was definitely nothing like that. So, I mean, as I mentioned earlier, when I came to the US and started my PhD, I definitely want to stay in academic path. So that was my first initial plan. And soon after, I realized it's not really fit with my interests. I'm not a big fan of writing.
First of all, I'm super excited for today. First, because of the topic we want to cover. I think for myself or anyone want to educate in computational biology, drug delivery, or basically application of the AI, today is a very interesting discussion. And also because of our star guest, Leila John, has a remarkable journey.
Thank you.
So we are thrilled to have you here. Just setting the stage, I give a brief introduction about Leila. Obviously, she was born and raised in Iran. She went to medical school, but she left because she missed math. And then she started her journey in biotechnology in University of Tehran. Between her undergrad and master, she went to Federal Institute of Technology in Zurich. If you know, it's one of the most prestigious research institute. And she worked in developing algorithm. And then she came back to Iran and finished her master. I think one of the most pivotal moments in her academic journey when she came to US and started her PhD in Massachusetts Institute of Technology, MIT. And in 2016, she published a paper in Nature magazine that we talk more about it. And she actually founded a company based on that. She's very famous. She's one of the thought leaders in that field. But one of the things that I think our audience should check is a TED Talk that she gave on 2019. It already gets more than 2 million views on the TED website. So happy to have you here, Leila John. Just for first question, I was super curious about your path to MIT. And I think it's not very traditional when you graduate from University of Tehran and you straightforward go to the MIT. So give us a kind of high level, what happened, what's the backstory about that? And my second part question is about your experience at MIT. I think you did a profile with MIT and this is your exact quote. Sometimes you get somewhere and you like it. Oh, it's okay. That's it. It lose its sparkle, but MIT has never in that way. It never get old. So as an MIT alum, what was the significant about MIT? So just two-part question.
Thank you so much. So hi, everyone. Thanks for having me. And also thanks for the kind introduction. I'm really honored to be here and tell you guys a little bit more about my journey. Yeah, so I'm just going to start from basically Iran and how from University of Tehran to MIT. So, I mean, when I was in undergrad, I was just really fascinated by the science and research. So that was my biggest focus was, you know, at the time, I think when I went to my undergrad, like AI and, computational biology was not a field that was hot at the time. So right now is quite of a difference. But I was very fortunate back in University of Tehran to work with one of our statistic teacher who was using actually at the time like advanced statistical modeling in understanding biological data. And this was back in 2005 and 6, like, human genome was just recently sequenced. We were just starting to be able to handle larger scale like data set, and the computational power at the time we had was so limited. Like sometimes it's funny for me how much RAM I had in my computer. So at the time I was just really fascinated by this subject. So I started doing some research with basically the professor at University of Tehran who at the time was also the dean of School of Science in University of Tehran. So I just really got fascinated by that field of basically intersection of biology and math and computer science. And that basically led me to my career path. And starting from just doing research, just really focusing, trying, and I was fortunate to publish a couple of papers in my undergrad. One was I was first author, and also a couple of other that I was co-authored with some of my colleagues. So I think that really helped to build the foundation to the research project and also getting to MIT. And I remember like I was just really at the time was just mostly fascinated by science, and of course I wanted to continue my education in like an institute that are very focused also in this intersection. I was fortunate also to do some research in Switzerland at ETH University. That was also very helpful to build up on my research career and path. And actually, really interesting. So when I was in Iran, I was trying to apply for graduate school. I basically find some professors. This is like independent of like, because every university, they have this process of applying for graduate school and like, submitting your application, your, letter of statement and basically all the other, resume and everything. So one thing I did, I was basically looking again on the research of some of the professors. And then I basically just email them and tell, hey, this is what I've done previously. I really like your research. I, was very interested, and this is my resume. Do you think even I have a shot to apply for your graduate school program? And actually, funny enough, so I remember at the time I really liked the lab I joined to MIT. I really loved the research so that we were doing. And so my PhD advisor, Ernest Frankel, who's currently a faculty at MIT Biological Engineering department, and he was doing kind of network modeling. So I remember back in Iran, we had a journal club, and I presented some of his work, during my master's degree. And I was so fascinated with his work. I thought, oh, this is really cool. So I actually wrote him an email and I say, hey, this is what I've done. This is my papers I published. I really like what you're doing. And he even get a call with me. So I remember at the time because it wasn't Zoom at the time. I don't remember what technology we were using. So we were like doing a call with me, and then he was just basically asking me lots of questions of like my research, and he was also very like kind with me and they give me feedback. He was telling me, hey, MIT is very competitive, apply, but just don't put all your eggs at the MIT basket either. Apply for other graduate schools too. And so I think that really helped me. So I think if any of the audience, I think they're looking for graduate school, I do think it will help to reach out to some of the PIs already in the department, but also not just, it shouldn't be so random. Like it should be really tailored to the research, because that really you get the answer. Like if you just randomly email and there's nothing relevant, you don't get people's attention. So that really helped. I think the research I built and what I really wanted to do was very aligned with the program I got into MIT, and I was very fortunate. Like even at the time, I met my PhD advisor, and he was even telling me, "Say, hey, you don't have to join my lab. I know we had a call, but because we had a semester at MIT to figure out which lab we want to join, so we're just mostly taking classes, and we did orientations in different labs and to see which lab we want to continue doing our research PhD project." So I think that was like a first part of basically like how I get to MIT. It was really focused on science and trying to do a good research and finding a good graduate school fit and a lab. And I was again fortunate to join Ernest Frankel lab, and doing research in his lab. And I was really interested of the work, so I was just very passionate about the science itself. And I really liked the whole intersection of basically what he was doing, specifically in network biology, network modeling, and also the application in biological setting. I forgot the second question. Was now move forward to the
Yeah, so the second part is that, so thank you for the first part. The second part is that, so as an alum, you mentioned that you have very different and unique experience in MIT. I just want to know, what was that experience? What's specific about MIT that, you know, differentiate from your viewpoint?
I think MIT was I mean, it's going to MIT, you know, when I got there, I was also very scared at my first semester. I was like, oh my God, I hope there was no mistake. You know, you just like, sometimes you get to, like, I was like looking up my classmates, I was like, oh wow, they all went to this really great schools. I was also like, you know, worried. I was like, do I even fit there? Do I, like when we were taking like our first semester class, I was like, do like what my background is good enough for compared to the rest of my classmates, right? So at the beginning, it's always like, I feel like lots of people might feel that when you come from Iran to like the US, so it might be like there is a differences, and like sometimes if you feel maybe you're not belong. But one thing I really like about MIT was everyone at school was very passionate again about science, and everyone was so down to earth. So that was one of my thing I really like about MIT. Everyone was doing really cool science and work, and everyone was so down to earth too, and they were very helpful. So I remember, so because I was very interested in AI angle, so I took one of the most advanced machine learning course at MIT. So I was basically taking it with computer science PhDs. And it was a really tough class, and I didn't have many of the backgrounds that they previously had. So I was really worried about that class, and I wasn't sure like should I drop, because I was taking it as an optional class. I wasn't sure if I should keep the class or I should like, you know, drop it. But I remember like it was very helpful like environment. So everyone was so helpful. Like we were spending a whole week doing like a homework in the class, collaborating with every other classmate. And so everyone was very helpful, and they just really want you, they really help to basically teach everyone about the science that they were doing. And everyone was very passionate about their work. So that's one thing, it was very unique. That was one angle, I think the scientific angle. And the other angle was what I really like about MIT was also the opportunities besides science that I was exposed to. So MIT is, I mean, there are other schools, so I don't think MIT is the only one, but it was a very entrepreneur environment at the school. So I mean, growing up in Iran at the time, I mean, now it's a bit different between considering to when I was growing up, there was an, I didn't know too much about the startups. I didn't know like what my career, like the only option I thought in my career path is to become an academic professor. So coming to grad school, that's what I thought I'm gonna do. Actually, that's what all the letters I wrote in my, you know, to grad school, because I want to stay in academic, I want to become a faculty. And at the time, I didn't even know what other options I could have, because I thought what I do is very pure science. That's it. Like basically, that's the other only option existing. But I felt MIT, like there was so many other opportunities that I could explore. There was so many different groups at school, like different committees, and everything you want to do, you could explore. Like I even explored to become like a management consultant, and there were so many opportunities I meant to focus on, like during grad school, like so many different clubs and everything. They were doing different work, and there were the opportunities outside of basically just academic paths was really like good, and there were areas that we could basically explore. It wasn't just like there was talks, but you could actually do actions toward like different factors that you like, and there was always support for students to do that. So there was every time like you want something, there was some sort of a support at university. Like you want to have a career consulting, like you want to do a writing workshop, like improve your writing. There was everything was so available, and I think that's made it so unique. I was just really blown out by all the opportunities I had. And I was like, wow, I could do all these things. And everything, like, I don't need to pay for these things. So I could basically take any classes. So for me, it was really eye-opening. I was like, I could take any classes I want at MIT, which I ended up taking lots of classes. I took like computer science classes. I took like MIT business school classes. I was like, wow, I could take everything I want basically. And I was really blown out with this availability of, as a student, how much support we had. And I think that was one of the biggest thing I really like about MIT, except the science, basically.
Awesome. Machine John and Farzan, go ahead.
I do have a question, Leila.
Thank you.
Not everybody is academically or like likely to get into MIT, but we have MOOCs now, massive open online courses. I was wondering what courses that you took at MIT helped you the most with the path that you've taken, that now like others who are not at MIT, at least like now with all the education and knowledge available online, they can do that outside. Like it's especially there are a lot of PhD students that I hear that they want to either go into industry or start their own startup. What do you recommend to them to take outside their academic courses?
This is a really good question because actually, like, I feel like the whole landscape of education has changed so much in this past 10 years. Like at the time, like none of these online courses was available. And the interesting part is that I actually had to take online courses after I graduated, because when I was in grad school, so as I mentioned, I took like the most advanced machine learning course at MIT. And at the time, there was zero thing on neural network models. So everything was in traditional machine learning. I remember so much support vector machines, like everything, like barely a touch base on neural networks. So, and I took this class, I think, back in 2011. So it was really, really not an AI hot topic at the time. So even for myself, like, because the science changes so much every year, like, we don't learn so many things in the school. So I think the continuously learning the different topics is like, it's not just for, it has to continue even after school. So I actually took like, I remember after I graduated, I took lots of the Coursera. So I actually got a Coursera subscription for the whole company. And I was telling people, I said, hey, you guys, you should take, I recommend these are the really good classes of, Android classes, like neural network models. And right now I was very fortunate. Like I feel like the whole like field, especially in computer science, there are so many online classes available, and sometimes really good classes you could online watch them. So we do a lot of neural network modeling in my company. And I know one of the most famous professor at Stanford, I think Yor Leskovic, he put all his online classes available, all with the slide deck. You could watch them on YouTube. I actually sent that course class to everyone who joined my company. I was like, hey, you guys need to watch these classes before to like, because I think this is a really good topic. You guys will learn a lot. I mean, there's so much available. I think there are even blogs on CS, like the number of available academic courses. It's really depend on everyone's basically interest in the area for the expertise. But I think like learning online classes should be continuous and definitely even after graduation, because science changes so rapidly. Yeah.
And how about some like you mentioned writing class courses you took, you joined clubs for example, management consulting. Like which soft skill focused courses do you think a grad school student should take to prepare themselves for the industry?
I feel like soft skills like the one you need to learn by practice. So I don't know if it's like it's a bit hard to just like learn like soft skills. I mean, I've read lots of books on management. So since I started my company, like that's one of the things I think you don't learn too much in grad school is the teamwork. Like in grad school, you learn really well to be independent thinker and problem solver. And that's, I think, what's make a grad school unique experience. So you learn to solve a problem, but one thing you don't learn is like teamwork. I would say so. It's a little bit hard. Like I read lots of books myself, like about team management, team productivity. But I think at the end of it, it's all about like putting this into practice. So I think like maybe for people who they could do some project-based collaboration. So something is small that I think soft skills mostly learned during doing a project with other students, or I don't have any specific thing in mind, but I don't think it's just like would be just a class. I think it's just something that could be collaboration between people that you could see what, because in you could do a project. There's gonna be always a conflict between the team members. Some people do have different ideas, some people don't have different ideas. How to hear everyone, how to effectively say your idea while also taking other people's idea in mind, and like delivering things in the timely manner and collaborating. So I feel like this is something that's more, it's good to like learn about on books. I mostly did books, not classes. But I think at the end you need to put it in practice.
That sounds great.
So, I have a question about Boston. Boston is always very interesting for me because, it's home to multiple Ivy League schools like Boston University, MIT, Harvard, all these names that really impress you. All of them are there. So I want to ask about, it's my personal curiosity that, okay, having all these like universities in one city, how can it help you? Did you have any chance to collaborate with like students from other universities? How could this help you in like, I mean, in this special vibe of Boston?
Yeah. No, I think that's really unique environment about Boston that have so many academic institute, also industry partners, there's so many pharma there and also hospitals. So I think that lead to a really unique ecosystem to grow collaboration. And it definitely helps. Like we collaborated with lots of I mean, like I think at MIT, I didn't do it, but I think you could even cross-register for any Harvard classes or some of the Harvard classes. So we had like a students from Harvard that were taking MIT classes or vice versa, and there were always like some hackathons, some weekend, something that was between schools that you could participate, and people form teams to basically leverage like a different expertise or different departments. I think the other thing was particularly was interesting is the academic hospitals because, for example, like at MIT we didn't have med school, so that was something like there was so many hospitals around. So if you want to like collaborate with hospitals, like getting patient samples or understanding how the doctors make decisions and how you like improve on that and how you learn about what's the current stand of the care is. So I think I really like the fact that there were so many hospitals and they were all mostly academic hospitals around, so you could basically connect with people, meet them super easily. So my experience mostly, I've worked with hospitals in the Boston area, and it was very easy to connect with them. The Harvard Medical School, I attended so many talks there, so there were like really important talks with like they bring really famous professors, and the talks are usually open to lots of people, so it doesn't matter actually you're part of school or not. So there were many talks that they were organized by a specific committee that were interested in like genetic data or some sort of like academic science, and those talks were really available for everyone and everyone could participate and learn.
Back to your path and your journey, Leila Jan. So I think the most important part of your academic journey is the paper that you published. The title is Revealing Disease Associated Pathway by Network Integration of Untargeted Metabolomic. So just wanted to see as a high level why you go for this category, leveraging metabolomic for the disease that there is no like treatment for it, and what's the story behind it?
Oh, thank you. Yeah, so when I joined my PhD lab at MIT, I had no clue what metabolites are. So I just love the science. So my PhD advisor was doing network biology, and I was very fascinated with the network science and how we could use a network modeling approach to, to understand biology. And while I was doing my PhD, we basically was like 2 years in, I was just doing basically more combining actually proteomics information with epigenetic data. It's like these are the modifications happen in our DNA. So we want to understand how those molecules are connecting to each other in our biological network. And then we basically did some discovery that was like, oh, and they identify some novel mechanisms associated with the disease that involve some metabolites. And this was some lipid molecules were associating with the progression of the disease. So for the audience, like metabolites are these small molecules like glucose, cholesterol, all the things we hear in health and diet. They're actually very important part of our biology because they actually, in the molecular level, they connect with so many different proteins and they lead to some of the downstream mechanisms that we observe in our biology of a disease progression. So we identified basically that mechanism, and we actually asked a collaborator, actually they were in Harvard University, to do the measurements of those metabolites or lipid molecules for us. And I mean, they shared the data set with us, and then while they shared the data with me, like what I was talking with, and then I shared that with my PhD advisor at the time, was like, oh, they shared this whole like really big Excel file with me. It has like, I don't know, like 1,000 rows in that Excel file. And they were telling me, oh, just use the top rows of this Excel file, like the bottom rows. We don't know what those things are. Like, we just don't know what those molecules are. So just don't use them. And I was like I was like, what does it mean? They share data with me and they tell me not to use the data. Like, why is the case, right? Like, why we cannot use the data? Because I was more into data science, mindset. I was like, why does the data and it's not useful, right? And then I was like talking with them when they told me, it was like, oh, because we don't know what those molecules exactly are, and there's ambiguity in the data. And I talked with my PhD advisor about it. I was like, yeah, they're saying there's ambiguity in the data, we cannot use it. And I was saying, oh, maybe we could solve that problem, like solve this data ambiguity problem using some of this network modeling we are doing. And I was kind of start thinking about it. I was like, well, this is actually possible. Like we do all this network modeling to connect basically disease molecules with each other. And maybe that connect how we're connecting those molecules, we could also say reduce the ambiguity in the data as well. So we basically represented ambiguity in the data as a graph, and then we use a graph modeling to resolve those ambiguities. So basically that was really like understanding some biological problem that was existing, and it was like, it was there, but no one was like trying to solve it using a data-driven approach. And we basically kind of translate that bio problem to a data science problem. So I think that was a key factor for us. It's not just, this is not the biology problem anymore. This is the ambiguity in the data. And there is a lot of methods you could resolve the data ambiguity, right? So I think that was like a key factor for us. And that leads to a nice discovery, and we validate that. And because it was like we were fortunate to be able to publish in Nature Methods because the methodology really overcoming some of the limitations in the field. So it was really adding value to the field, and that's helped with the publishing it in a good journal as well.
So when you talk about the ambiguity of the data, I just want to double click on that. So what's the base of that ambiguity came from? Because each one is different. What's that? Could you please tell us what's the ambiguity?
Yeah, sure. So one of the instrument measurements that you use to measure basically lipids or glucose or all these blood metabolites or any other metabolites is called mass spectrometry instrument. So these are the machines that really accurately measure a mass of a molecule. So, but there are many metabolites with identical mass. And I have this really dummy example. If you measure a molecule with a molecular mass of 180 Dalton, that's like a unit of molecular mass, it could be glucose, galactose, fructose. All these three sugars, they have identical mass. So even though you could really highly measure what that mass is, you don't know what that molecule, we don't know if it's glucose or fructose, right? Or galactose. So to resolve those issues, currently people have to do more experimentation. And of course, experimentation is always at the bottleneck. It requires more time and cost, right? And right now we could characterize glucose. It's such a well-studied molecules, we could, but like it's not scalable for tens of thousands of molecules that exist in our body. So we basically represent that as a graph and then leverage some like knowledge-based graph to figure out if that 180 is changed in like a blood of a patient, this is glucose. And we could say because glucose is better, how glucose is connected to the dysregulation of other molecules that we also observe in that patient. So that's how we basically reduce the ambiguity in that data.
Guys, you have a question?
So, when we have like machine learning, deep learning, we need a lot of data, especially for like metabolites and molecules that you mentioned. I want to know what are the sources of the data, and you need it, you need to update it, because without like data, we cannot progress in the field of deep learning AI.
Yeah, it's a very good question. Yeah, that's one of the biggest challenges I think of using AI technologies into the biological setting is actually the limitation of the low availability of the data set. But of course, machine learning, you have supervised learning and you have unsupervised learning. So in the supervised learning, you know what the answer is. So for example, you want to classify, you do image processing. You say, hey, this is a dog, this is a cat. And you need a lot of training examples to say, hey, this is hey, machine learning, learn this is a dog, learn this is a cat to predict in a new case. Lots of the work we did during my PhD, at least, they were all unsupervised learning. By unsupervised learning is that we do not know the labeling of the data, but we're just trying to learn the pattern in the data from what's available. And this is specifically more useful for the bio because if we know that, if we know already the labels to data, we already cure all the diseases, right? So there's everything, there's just so much we don't know. So many of the work I did during my PhD were unsupervised learning, but we do use some prior knowledge, because we did a lot of network modeling and network optimization, and we've developed a knowledge-based graph for the human biology. And that knowledge-based graph was used as a prior knowledge to find the pattern in the data. And for developing those knowledge-based graph, these are mostly coming from the public domain and the literature. It's a lot of pain to put them together. Actually, we spend a lot of time in my company to actually, because public domain is very noisy. They're different heterogeneous formats. So we have to actually put a lot of effort to combine public domain data set and use that for downstream analysis that we did as well.
So did you try to build a data set yourself? Like you yourself work on the data, try to prepare it. I mean, something coming from your own company, not from like a public source.
Yeah, so we've basically collected our own data set from this study. Like we work in a disease area called NASH. It's a liver disease or non-alcoholic steatohepatitis. So the data from those patients we collected ourselves. So we collaborate with hospitals, we get patient biospecimens, and then we did the measurements. But again, to still do the inference from that data, we leverage lots of knowledge-based graph from the literature. So it's a combination of the public and the proprietary data sets that we have to use.
And then for one last follow-up question, please. Do you think we have enough data right now in this field, or do you still think that a lot of room for data, like data preparation, like making data set? I mean, can that be a business? Can making data sets in this field be a startup itself on its own?
Generating data is really, really hard. Generating new biological data is very challenging. I think we are not even close anywhere to have enough data for human biology, so we would need more and more and more data. I do think there are lots of the companies and startups right now, some of their key technical advantage that they're pitching to VCs are actually their database asset. So I know companies that will say, oh, we have this number of patients in our proprietary cohort. So definitely a proprietary cohort, it's a value added to any platform. And I do know that, AI is big right now. So actually, I do know investors, they care more a lot about your data actually than the algorithms, because algorithms are, always developing. It's hard to patent it. So that matter a lot. I mean, the other option is actually harmonizing data sets. It's a lot of work to actually harmonize data sets. So I know there are companies who actually do that, in the biological setting. So there are companies that, hey, access our software, we harmonize all these public data sets so you could easily access and query that. I know, I'm not sure, synthetic data, I know in the field of non-biological setting, I think synthetic data generation, there are companies are doing that. In biology, I mean, I don't know exactly what's a good synthetic data generation in biology. I think it's challenging in biology to generate synthetic data because we just don't know what that data is going to look like. We don't know exactly the variance and the bias in the population to be generating a new, synthetic data. But definitely, I think the generative models are helping in people generating synthetic data for a specific patient or predicting the future of that patient based on their past data. But yeah, I think there's really exciting opportunities in that aspect for different startups for sure.
Thank you.
Thank you.
Shrijan, you have anything to ask or go for it? No. So then you in love with your problem that you actually found a company based on that, which is not traditional. I think you did bunch of internship on pharma industry, on Merck and others.
Yeah.
And then you see, okay, I can found a company and Revivemed, I think founded in 2018. So that's I think it's really interesting to point it out. So how was your thought on that time?
Yeah, it was a process. It was not like one day I woke up and said, "Hey, I want to start a company." It was definitely nothing like that. So I mean, as I mentioned earlier, when I came to the US and started my PhD, I definitely want to stay in academic path. So that was my first initial plan. And soon after, I realized it's not really fit with my interests. I'm not a big fan of writing. So I was like, I don't think academic would be a good path for me. So I was like thinking, and I was fortunate to be really, having opportunity to explore different angle, like what's really, excites me, what gives me energies, and what I want to do. So the next thing I was like, okay, if it's not academic, then it's industry, right? So I was like, it was very easy. I was like, okay, let me just, and the good thing is like I try it out. So I think I really highly recommend with any students out there, if they still don't know what they want to do, it's just give it a small try, like 3 months project, something to see if you really like it before just jumping into it after graduation. So I did a couple of internship at Merck and also Takeda Oncology Company, and I was really working with amazing team, like really amazing scientists, or really doing a cutting edge science in this big pharma. But I just didn't like. I just really like at the time I really liked the academic passion, and I was just like, oh, industry is not fast paced, or like I felt like in academic we do so much more new things, and more industry they were just adopting what's already published in academic science. So it wasn't just more about innovating at the time. So that was something that I just didn't like as much. I was like, I'm not sure if industry passed for me. And I think that was the kind of in my middle of the PhD. I just really didn't know what I want to do. And I actually just started doing some management consulting projects, and because lots of my friends back in school, they wanted to go to McKinsey. It was very common. They come all the time to your career fair, like they do a lot of things to actually recruit you. And I did like a couple of projects that, oh God, no, I do not like that. I love the science. I just really miss the science part. I was like, it's just fun, but I'm passionate about science. And then I had really close friends back at MIT that they want to they always talk about having a startup. So it's like I have some of my closest friends was, oh, we want to just do our own company. And then that's they were very excited about. And at the time, I really didn't know what it means to have a startup. Like I didn't even know how to start a startup company. So what I did actually, I went to the MIT course catalog of the Sloan School of Management, and I looked at the description of all the classes. And there was one class I really liked. It was like how to turn your idea to a startup company. And I was like, oh, this is really fun. So I signed up for that class. And then I had no idea at the time, like how the startup is. I didn't even know about the loss of available resources to start companies either. So I think that was the first class for me to just learn about like a startups and what it is. And at the time, during that class project, I actually pitched idea was I've been always like interested in like a healthy lifestyle and then how to do disease prevention. So we actually pitched idea like how to do disease prevention, and we were planning to develop this no diabetes app that basically help patients who are like pre-diabetics with changing their lifestyle so they will not become diabetic patients. And during the whole class semester, I loved the process. I was like, oh, this is so much fun. I really like the energy. I just like how it's fast-paced is. But one thing was missing. I loved science. So that's one of my from early on, I started graduate school. I just really loved my PhD. And I was just thinking at the time, it's like, can I do something with my PhD? Is it possible? Like, I love the startup, but I don't want to develop a diabetes app. Like, I mean, it's cool, but I just really want to do something that I'm passionate about more. So during the whole process, like turning a science to a PhD, like a PhD project to a company, it's kind of challenging itself. So usually lots of startups are built because there's a problem, and then they try to answer this problem with the technology. But at the time, what I had the technology that was doing something cool, like it was analyzing some data, but then I had to try to find a problem to solve it with this technology. So what we really study is not from 0 to 1. So, if you read lots of books from 0 to 1, we're studying actually from -1 to 0, and then from 0 to 1. And that's actually really interesting. I know actually NIH there are some programs that actually try to help like finding like basically commercializing science. So at the time I was because I got to know more about MIT School of Management during the class I took. I was very fortunate to take one of those classes with kind of similar format. So I pitched my idea to an MBA class, and I was participating in class myself at the same time. And during this whole class process was like, okay, we have this really cool technology. It was different technologies. What's the most path to add to the commercialize this technology? And so basically, it's a very iterative process. Like you start from like just brainstorming a whole bunch of ideas. Like we brainstorm from like, oil industry and measuring like bacterial oil metabolites to like a newborn diagnostic to so many, many different things. So like really wide topics. And then trying to basically narrow this down and talking with the industry leaders that how this technology could create value in that field. And also, it's not just creation of the value. You want to create the most value with the least amount of spending and least amount of cost. So I love that whole process, and that process basically lead to my company. So actually, my company was born from that class project. I couldn't immediately start right after because I still had to graduate. I need to write my thesis. But it was just the beginning part, and after that, I was just really using that idea that we had at the time to further grow the company. And I think this whole like iterative process of product market fit or actually learning the idea, it's continuous throughout the whole company because every day the market changes, the new technologies comes out. You work in a disease, tomorrow there's a FDA approved drug. So there's a lot of things could change, and being able to adopt those changes and learning. I think that's a really amazing skill set I learned. And I highly recommend for it. I think there are right now, actually like there's some incubator programs that do help with the PhDs actually to turn the science. I forgot there was a name of actually, I think it was an NIH program. They also give them like I think 50K to explore that and actually turn like a scientific idea to a commercialization path. Like a best problem actually to find to solve using a scientific technology. Yeah.
Awesome. So your startup is a spin-off from MIT. So just to be clear, MIT is a shareholder on your company?
Yeah, so we have to have exclusive license from MIT because the technology is patented, and there is a licensing agreement which also includes some equity at the company.
Okay. So when you graduate, you already raised money, or you just happen on after your graduation establishing? So give us context on that.
Yeah, so when I graduated, I stayed at MIT for like a very short postdoc, and the reason was a lot of the visa stuff. Like it's a little bit harder to. I think there was some rules was changed that the OPTs were not at the time so easy to be a founder. So I just stayed to basically apply for my green card, and I basically left MIT in 2017, and I raised money in 2018.
And how was the progress how was the progress for Revivemed since 2018? So you are graduate from MIT, you are advocate on that field, kind of like you're a thought leader.
Yeah.
So how was the progress of the company for you so far? It's fun in the real world or still challenging or?
It is very hard to say. It's a lot easier when you're still in school. I feel like when you're like, I mean, that's the thing, like when you're still a student and then you try to reach the people in the industry, I feel they're more open to help you out. But usually it changes a little bit. And it's very difficult. So a startup company, it's a very, very difficult process. So, but it's also very rewarding. I mean, I would never learn as much I've learned in the past few years that I started my company, both in scientific, both in learning about the industry, presentation skills, and also, the soft skills. So I would say that the most thing I learned was actually the soft skills. And it's a process. So every time, like, we basically, since we started the company, we've also changed a lot of our focus, our pharma offering, because it's a whole process that you learn and you adopt. Like something I could publicly disclose is that we started the company working on a disease called NASH, and I think we mentioned that it's a liver indication. It's a huge problem with no treatment right now. And in the middle of the company, we was very fortunate. We did a public announced study with Bristol Myers Squibb or BMS. These are a big pharma company that are very leader in the field of immuno-oncology. And in immuno-oncology, our own immune system is activated to attack the tumor cells. So at the time, I mean, we were very fortunate that that company realized our technology is really fitted to that problem. So it was kind of very similar to where I started, like, finding a problem to solve with the technology. And like since that collaboration, we realized there's such a market opportunity and also technology fit. So it's not, of course, there should be a market there, but also there should be a technology fit. So we were able to do this really exciting collaboration with them, and we were realizing this new opportunity for us that, and then that's something that we're also internally following up on that. So there's a whole, it's ups and downs. It's a tough process. It's market changes. There are things that you cannot control, right? So like last year has been like very brutal. Hopefully I'm more positive about 2024. There things could change all the time that impact, but I think it's more about every entrepreneur out there. It's just all about the journey, like doing your best, and the success is not really the end output of like if your company is exited, but it's a lot of like what you do, how much value you create, and how much you learn, I think, during the whole process as well.
Okay, super interesting. So what is the product that you just a technology or the patent, or what's your progress in terms of the product you're going to deliver to, I don't know, is the business,
so we do a couple of things. We have a couple of products more specifically in NASH. So we're finding therapeutics in NASH, and then we're also finding some biomarker of drug response. So these are the things we internally develop. But at the end, we work with pharma companies, and at the end, everything will be licensed to pharma. And one other thing, we do also have a proprietary database asset and a technology that we do that offer that to the pharma companies for different angles. So we mostly work with pharma. So they basically, for example, we have pre-trained models, and we could leverage those pre-trained models and an AI algorithm to find the novel therapeutics. So they're, for example, interested in the disease. We help them to find this therapeutic, and they follow up, or they're interested to figure out what patient would respond to their drugs in clinical trial, and we are able to stratify their patients. So say, hey, these are the most likely to respond to your drug, so we help them to increase their FDA approval rate. So mostly working with pharma, we basically, by providing them basically our technology, our proprietary algorithms, and also database asset we have. So we provide solutions to them using this proprietary technology. But we also do internal development. We have 2 programs. One is in NASH, as I mentioned, that we internally develop them ourselves. But our goal is at the end is license them to pharmaceutical companies as well.
Shirin, Fazam, questions?
Startup field is like very fluid, but one thing that is always there is pivot. You have to pivot. I want to ask about your pivot. Did you have to pivot? And if so, what are those pivots that you had to do?
That's so true. So you really need to adapt with the market. So you, at the beginning, actually that was a very, very beginning when I started the company, we wanted to do drug repurposing. So that was the thing. Like, there is this drug that failed in clinical efficacy for this disease now. So there's so much clinical data on it. Can we get this drug and repurpose it for a new indication? So that was like, I'm not sure if we call it as a pivot, but that was our initial idea that we wanted to do that. And then soon after, I was, trying to pitch to pharma companies about that. And I was like, well, no, we don't want to do that. There was so much issues that we learned. It's like, it was the initial idea generation. And then they were saying, oh, there's a patent issues. If a drug is shelved, don't want to touch it. There was a lot of things we realized about that past. And then while we were pitching it, they were saying, oh, this technology is really good for doing this, or this technology is really good for doing that. So for us, wasn't like a specific pivot, but it's really important to learn from your customers and the market and get the feedback to see where you could actually put more money to grow, right? So it's more like what's the market is today, what the market is tomorrow, and then this is gonna be the most value I'm gonna create. So maybe it's just use more money to do it, not raise money to do that more. But I think it's the most important thing is to be close to your client and customers and just trying to learn from the industry and get feedback, because things change all the time, right? Like yeah, new technologies come, like everything will change a lot.
Thank you.
So Leila Jan, I'm kind of curious. Let's talk about the industry that you are work on. I think so. You are a big advocate about the application of the AI in the pharma, and you have speeches that the pharma industry is not adaptable about technology. Now we are in the moment that Gen AI, everyone talk about it. So, what's your perspective about the industry? Basically, computational biology, pharma delivery, whatever. What's the specific sector, and what was the development and progress that we had on Gen AI and AI? So what was the application on that? What going to see exactly as a customer or a commercial this year in terms of the trend? Like, do we have designed the drug based on the AI, based on a specific patient for the disease? What's the main thing that's going to happen?
No, that's a great question. I feel like pharma maybe was one of the late adopters of AI, but I feel like AI is so big right now, so definitely every pharmaceutical companies, they do have some focus on that.
So why is that? So why is that?
There's a lot of times, like, they realize you do need to use it. They don't want to leave behind either, right? But there is also value added. So more and more there are many startups right now, they use artificial intelligence, right? So they pitch out, they hear all those things that they are actually value added. But I also have to say, pharma is still, they're still like not completely open to any type of AI, which kind of understandable. Like AI is a technology, is a tool, but still is not going to be the answer to everything. So there is this new tool that they want to use it, but it still, that requires experimentation, still needs to do biology. So I don't think anytime soon will replace biology completely. I think we'll just augment biology and enhance the design of the experimentations and the design of the study, then completely replacing that. So you could automate the process and make it a lot faster and more efficient than completely replacing that. But also one other thing is like the type of the AI that they like. I feel like through at least my conversation with pharma, I think pharma don't like really black box models. Like they want to know why something is relevant. So even for us, like we find some model and the features from these algorithms, oh, this is, they have the highest attention. Like this is like the most predictable model, right? But for us, actually, we need to translate back to the biology, like why is the case? And like this translation of the data to the biology, I think that adds a lot more value to being able to pharma adopt it. I was like, okay, we understand that those features are, fine because of these pre-trained models, and that's what you came, right? But at the end of it, why those features are so important in that biology. So I think being able to translate that back to the, why this is the case, I think would really help with the adaptation of the AI, specifically in the biological setting. And I do see like one other thing would be also FDA. Like I think the regulatory process matter too. So pharma is not going to do anything that FDA won't going to accept it at the end of it, right? So there are actually AI startups right now that they working with FDA and they got FDA endorsement that hey, we could use this AI tool as like these markers up to stratify patients. So I think FDA also being more open to some of the tools that are AI based to design the clinical trial, that would add a lot more to the field because, if the clinical trials are extremely expensive and, at the end of it, if you could save some money or like reduce the number of patients needed or improve the outcome, I think will add a lot of value. But again, FDA also should be on board to make sure those tools are, approved by the regulatory process. Because at the end, if FDA won't agree how you stratify your patient using AI, it doesn't matter, right? Like no one want it. So I think there has been some endorsement from FDA that from some of the startup companies working in the field. I think that's helpful. But I think at the end of it, AI could help a lot with the drug discovery process. So a lot of the chemistry stuff right now is done with AI. It's been one of the first, I think, application of the AI in biology was drug design. And I think most of the companies right now, they have some sort of AI-based drug design. And I think those are the areas that's very early adopted. Lots of companies are using that. Like mRNA technologies, a lot of those things has been based in AI and it's been really adopted. So I think we've seen that the progress so far in the field. So, I mean, at the end of it, biology would never go away, but I think like getting to that biological experimentation faster or something and cheaper with AI would add a lot of value.
Guys, you have a question? I don't want to ask all the question.
Yeah, no, I do have two questions, Leila. The first one, you did mention interpretability and how important it is in your field. And you also mentioned neural networks and deep learning and that you're leveraging it. How do you deal with the interpretability of the latent space of variables, and how do you make it interpretable, basically?
That's actually really hard. So that's one of the things actually we're doing in my team. So because we do a lot of network modeling. So one of the work we are doing, we connect those things again. Like you could have a network as an input model, like a biological network, and then how those molecules are connected through the. So you could have another layer that's like a biological. I mean, that's the area of research. So it's like a open area of research. But like in there you could have actually a network of biology and biological pathways and an additional layer to your input, and you could see how they're connected to those network. Or it's a very open area of research. I don't. For us, we do a lot of network modeling, so that's what we address that. But I'm sure there's people doing the field like how those molecules are connected to biological mechanisms too.
No, that makes sense. I'm sure that will be a whole different podcast on its own to discuss that.
Sure.
Another question I had was around how do you see big corporations like either in pharma, like Genentech and such, or in AI, like Google. Google released AlphaFold last year to form the amino acid sequence. How do you see like startups like yours in this space competing with these large pharma companies that have huge amounts of resources and data, or like AI companies that have like a lot of expertise on the AI side? How do you see yourself fit in the picture alongside those?
I wouldn't say we're competing with them. So I would say they are like potential collaborator or, potential people who could complement them. So I know, for example, Genentech had, they have a new head that she's very big fan of AI, and they're very focusing on that. And they do actually a bunch of collaboration with AI companies. So I think I would not consider them as a competition. So I think there are people who could actually help you. But of course, like as a startup, you need to make yourself unique in something, right? Like I wouldn't go develop a new GPT model for natural language processing, right? But maybe using that GPT model in something that hasn't been done before, then you are going to be unique in that, right? So I think as a startup, it's building up on your proprietary, uniqueness, and developing that's going to be key. But I don't think I would not be worried about those big AI companies or a big corporation or big pharma. I would consider them as a potential collaborator and customer. And they're actually become more and more open to doing AI collaboration. But I think as a startup, the challenge is to differentiate yourself, not just actually from those big companies, from a ton of other startups out there. There are so many AI startups right now. There are hundreds of AI companies in biospaces only, right? So, and I talk with the VCs, everyone was like, there's so much AI. Like, I don't remember like why you're different from the rest of the people, right? So I think that's so important to show that, not just for those big tech companies, but also just be able to raise money compared to the competition out there. Yeah.
And one last question, Arnola, before we move on. So Leila, with the changing landscape of AI, your company is focused on biology, like application of AI and data in biology. Yeah. And you mentioned you have collected your own proprietary data, you're cleaning like public data, leveraging that, but also leveraging AI. With this changing landscape, what's your vision? Or do you see your company focusing more on the AI side and less of like collecting data and like leveraging open data, or still like having your focus on collecting data? How do you see, what's your vision basically?
No, I think one of the things moving forward, we do want to collect our own data sets and have more proprietary patient codes available. Because we've already like combined so many of the public data sets available. So adding proprietary data sets is going to be really valuable. So it's one of the things that we're actually moving forward and we plan to do. I mean, proprietary data set is always, a lot more valuable because you know exactly so much details about every patient, how the data was collected, so it's cleaner data. But I think public data set is really good for developing like pre-trained models, but again, fine-tuning it, I think, or validating, I think, proprietary data set, it's definitely, that's something we consider to do. Of course, there are really big like data sets become more available, like UK Biobank, they, this huge amount of data is generated for, I don't remember the exact number of patients, but there are many patients, I think, 500,000 patients. They have so much data and they're open, like you could collaborate with them. So you could actually write a research proposal to have access to UK Biobank data set. So I think maybe in the future, hopefully we will see more of those data sets are collected from large scale population level, because those data sets are extremely expensive to collect, but they are being collected using, I think, more like, governments of different, countries and the healthcare system there. So seeing more of those data also being available, that's going to be interesting for everyone, and using that data sets too.
Interesting. Yeah. So is it accurate to say that instead of going with the flow and like just focusing on AI and generative AI, you're keeping your unique value in having your own property? I mean, your company is focusing on having its own property data.
Yeah, definitely. For us, what makes us unique, at least, or we consider, is the type of data we are analyzing. So we are very focused on mass spectrometry data analysis. So that's our unique capacity, because there's so many different data modalities out there. So we're very unique in that because I think there are so many challenges exist in that data set that we've been really able to solve. So that's our uniqueness in the type of data we are understanding, and also the proprietary data that we add. But the algorithms is always growing. Like we had our own algorithm. Like my PhD was patented, and there was a whole process. Not the algorithm was not patented, but the process of turning the data to insight was patented. But now, I mean, we are using GPT models. We are doing the science of data science grows so much faster than you could do internally. So we definitely use a lot of algorithms that are available and being developed, and we just adopt them to that data type that we're analyzing. Yeah.
Anything, Shinja? Good. How far?
So it may be controversial, but I want to ask this, what's your point of view toward regulation and the regulatory body, which is FDA out there? I want to know if this regulation, FDA and all the regulatory bodies that we have out there are holding the innovation back in your field, because I know that it's very like conservative and normally it's very slow. So do you ever wish that, okay, FDA never be out there and then just you will be free, do whatever you want to do?
I think, yeah, it's controversial.
Be honest.
I think FDA. No, I think FDA is there for a reason. So, I just have to say, I think at the end of it, like, FDA is there because they want to have patient safety. And it's just, it's a tough process. Like if you remove FDA, I think we're going to see a lot more issues. So I think at the end of it, innovation should be regulated. I think like maybe FDA is maybe slower, like maybe if they would move faster, that would be a lot better. I think that will help with the advancement of the new methods. But at the end of it, I think if you remove FDA, we would not really be able, because the new drug could come to the market, could have severe side effects. It could, really not improve patient outcomes. So I think it's still really important to evaluate all that. So I think I don't think we could get rid of. I think regulation should be there. Maybe if they were faster, it would be better. But yeah.
So from point of view of innovation, I understand for the safety, definitely we need regulation. But how about the innovation? Yeah. Okay, maybe we need a new regulatory body for the innovation, because FDA is very focused on safety. How about innovation?
I mean, at the end of it, you need to have a product of innovation, right? So innovation would lead to something, right? There's improved therapeutics or improved diagnostic or improved delivery, right? So it's gonna be the end product of the regulation. I mean, the innovation would lead to it needs to be proved basically based on both safety and also efficacy, like if it's helping or not. I mean, there are other things that maybe it's not completely regulated by FDA, but again, I think it's a very, I don't know exactly the reason, but I think like access to patient data. So this is a thing, like again, like lots of times the patient privacy, or like if you have every access to everything, you could literally identify that people, right? And there's a lot of things could happen, like maybe like if the future employees, they will get access to the data set and not hire these people because of that, there's some disease condition they have, right? So there's a lot of things that's very tough, or like this, like the privacy of the people. So I think at the end of it, we want to innovate fast, but I think we also have to be careful. Like we don't want to really compromise patient privacy. We still don't know. I think AI is very beginning. Like honestly, the algorithm gets better. You could predict everyone's identity using some of the data that you have from them. And right now, all the data is de-identified, but it's not that hard. Like if you have more data from someone, you could definitely predict who they are. And I think it could be very scary if all this data available to everyone, right? So I don't know. I feel like we should still be cautious about some of those regulatory process.
Seems you are in the process of getting approved from FDA, so you don't say anything bad about I'm just kidding. You're so good, super nice guys. So just change the gear, Leila John. And I know I told you just 1 hour, so sorry for that, but you're gonna wrap up very soon. You're working on a very opportunistic field. So what the quality of, beside money, you look in the venture capital firm when you want to raise money, like the network, current portfolio, experience on the field? Do you have any experience talk to any kind of the Persian community-based VC firms kind of thing, or no, or talk about that?
I have definitely I think Persian is amazing. I have Persian advisors and I have Persian angel investors too. So that's definitely not the specific VC firms, but I have Persian angel investors as well. So no, I think the Persian is amazing. I've really been fortunate to connect with some of the amazing people here and then just connect you and just get advice. So I've been very fortunate about all of that. I think what we're looking for a VC, it's again like the most important is the shared vision. Like, so for us, do they, work in this field? So like their VCs, they have different thesis and focus, right? So for us, not every VC out there will invest in a company because they want to be in a specifically focused in biotech, AI, and this application, right? So one is believing in that angle, that there is value here. That will be the first thing. I think shared vision is very important. Like, how fast that money want to get their VC want to get their money back. Are they, because VCs, they also have to raise their own money, right? So they have the fund, and then how fast they want to return. They could sometimes really push you. Like they could push the founders to like get a deal or do something that you don't want because of the short-term return for them, and like a long-term path of those basically for your company. So I think shared vision, I think that's really important. I would recommend like especially if people want to sit on the board, like having calls with the portfolio companies. So of course portfolio company matter a lot. That's the first thing I look. I was like, what are the other companies those people invested previously? And like usually I actually give calls that people reach out to me, some of my investors that they doing, because at the end it matter a lot. Like if people really helpful, like I had like investors who's been like, I probably couldn't do it without them, without their support and being there. So really important to have good investors, not just to bring the money, but just really believing in you. Because there are some VCs out there, like, like when I started, everyone's saying, well, you're just a PhD, you don't know anything. Like there are VCs, they don't like a PhD CEO. They do not. Like they want to say, oh, let's just get the science and bring a real CEO, right? So if the VC already have this mindset, they're not going to support you. If anything, it's a journey, it's up and down, right? Like there are times things are not good, and I was like, oh, you're not good. Like they're not going to back you up to support you, try to replace you, or they just like take their support out of the company. So I think looking at what type of do they really believe in the female founders, right? Do they really believe in like first time founders, CEOs that coming just from academic? So I think those things matter a lot. And I think like with looking a little bit on the market, like portfolio companies they invested, and just doing a bit of a reference call with some of their portfolio companies that are usually helpful to figure out what are the right VCs are. And definitely, of course, the network of the VC matter. Like if they could give you a call, and then basically if you want to do fundraising, they're so well connected with one email. They could introduce it literally to everyone. So that definitely is something that's very valuable, right? As well. One other thing I would say is not just the firm, but the partner itself also matter. Because at the end of it, big firms, you're gonna work with one partner in that firm. That person is gonna sit on your board. So specifically focusing on that person itself also, it's also important, and also just the firm itself too. Yeah.
Super interesting. And you are in the active raising Series A?
We are starting soon, yes, but not yet, but we're starting soon, yeah.
So other question, just want to ask last question and wrap up from here. So honestly, you had an interesting, remarkable journey. So you came from Iran, go to the MIT, publish a paper on Nature, did the TED Talk, and start a company based on that. And when I see it from outside, I see like brave moves and also targeted specific moves that come from the mindset or decision-making process. If you want to share what's your decision-making process for these moves or behind that, what's your thought?
I mean, yeah, looking backward, I mean, there's a lot of things I could have done differently too, and like maybe my career path would be different. So one of the things I usually like to do is just getting feedback from people. So having good mentors around me that maybe they've been one step ahead of me, or two steps ahead of me, and getting their advice. And of course, you will always hear different advice from people, but at the end, you are the person who makes the decision. So I love to have mentors. So I've been very fortunate to surround with really good mentors and also good peer, like having really good friends around you who doing really amazing work and just talking with them. So I think that's really shaped the path of like what to move forward. And one other thing is just being proactive. So sometimes I like to. So lots of the things I did, it wasn't just going like diving deep into something. I just really like explore it a little bit. Maybe it's some small thing and say, is it something I like? Is it something I don't like? So, and I think just being being proactive in some of the things and then making decision toward that. So a lot of the major decision I made, it wasn't like so simple. So, I want to do this and that's it. It was like learning about this. Okay, this is something I want, and then what the next step is, and just gradually going toward this process and learning from that. Yeah.
Awesome. Anything else, guys?
Oh, this was great, Leila. Thank you so much.
Thank you so much. Yeah,
I've known you for so many years. I think for 7-8 years now, but I had never heard about like your journey in such details, and I really enjoyed it. Thanks for sharing it
for having me.
with us.
Of course, thanks for having me. I really appreciate it. It's an honor to be here. Thank you.
That's our honor. We have one like picture want to take, so just look at the camera. Yes. Okay, so yeah.
Fun. Thank you guys. Thanks for having me. It was very nice.
Awesome. Thank you so much.
Thank you. Thank
Thanks
you.
everyone. Have a great Sunday.
Thank you.
Bye. Bye.